Okay. Hello, everyone. And it's the top of the hour, and we've got people calling in from all over the country. And we want to thank you guys for being on this call with us today. And we have had a lot of questions lately coming into the home office about 7K healthcare plans. And, a lot of questions around what they do, what they offer, and how a lot of them are almost in astonishment of how we're able to offer these amazing plans. And we've teamed up with SBA Freedom Plans and done a lot of great work here. So what we want to do is we want to share with you a little bit today some of our excitement about these healthcare plans and what they can do and answer a lot of your questions. So what I'm going to encourage all of you to do is write down any questions that you do have. And at the end of the call, if you'll put them in the Q&A section, we'll try to answer as many questions as we have time for. And so if it's not relevant to the group, you can actually write into support at 7kmetals.com. We can try to get those answered. But we're also going to give you a phone number on somebody that you can reach out to if you have any questions regarding this plan. So to get things started, what I'd like to do is I'd like to share with you guys a few things here. So what I wanted to talk to you guys about today is really quick. I want to offer you guys up something. So first, caring for your bodies is one of the best healthcare plans that you guys can do. Eating nutritional foods, right? Keeping flexible, breathing clean air, drinking pure water, getting deep sleep, activating your muscles, avoiding stress, laughing, washing your hands frequently, and practicing social distancing during this contagious time. So we encourage all 7K members to do that. But, there are times in our life when the unfortunate happens. We get sick. We have to go to the hospital. There are times when we have unexpected medical bills that hit. And one of the benefits of being a member with 7K Health is we've teamed up with SBA Freedom Plans. And we've got my good friend on here today, Scott Fardulis. He's the president of SBA Freedom Plans, and we're excited to have him on the phone with us. And one thing I want you guys to realize is you might have people on your team that maybe they already have healthcare plans, okay? We have something for people who already have healthcare plans because we're seeing a challenge with healthcare plans, and Scott's going to review some of that stuff with you. Some people have $5,000 deductibles, all right? So what do you do between the first dollar spent and $5,000? We have answers for you. We have first dollar coverage in our healthcare plans. We have very low premiums. Okay. We have very flexible plans for everybody. We have individual plans, family plans, group plans, everything you can imagine. And we've got it right here under the 7K membership, which is just adds more value to our membership than ever before. So, you talk about, I love our wheel of benefits, guys. And one of them on there is 7K Health Plans. It's a huge benefit. And what I'd like to do is introduce Scott Fardulis, and he's going to kind of go through a few things with you guys on what is this? What are some of the challenges we're facing in healthcare? And why is this program so amazing? And we are so excited about it because it really is an answer to a lot of people's questions in healthcare. This isn't just a sideline thing, guys. This is real solutions. And there are entire companies that are looking at this saying, how do we team up with 7K so that we can get those healthcare plans? And how can we take advantage of that? So Scott, I'm excited to have you on the call today. And let's kind of go through this and tell these guys about all the amazing benefits that these healthcare plans bring. And I'll go ahead and advance these slides for you. You just let me know when to go to the next one. So turn it over to you, Scott. Thanks for being here.
All right, Jason. Well, first of all, thank you so much for having me here. I see some of my friends that I've known for years chiming in and telling me they're here. So it's good to see your names and your comments below. And, I've known Jason for a long time. Jason, I could say, is on my list of very closest and best friends. And I just have all the confidence and faith and trust in him in the world. I think you're all extremely blessed at 7K. He is a tenacious leader, a visionary for sure, and one of the most outside the box creative thinkers I've ever met in my life. And quite frankly, that's what's attracted him to me as a friend for all these years. And so, yeah, here at 7K Metals, we are bringing something to the 7K family that's never really existed before inside of our industry. And, you know, years ago, I found myself in a situation where I was really kind of, if I could be so blunt and say, just kind of ticked off and fed up with the traditional healthcare arena, that I kind of branched out on my own and just started and doing my own things to cover my family that I thought were very wise and intelligent at the time. And lo and behold, here's this brilliant program that's available. And I just feel so blessed and fortunate not only to have access to it for me and my family, but to also come to Jason and share this with him and realize how beneficial this would be to all of you and to your company. So diving in, this is the big question that you're looking at on your screen. What happens? I mean, with all the preventative things that we can think of wisely doing, which Jason just shared with all of you, what happens when you absolutely need traditional medical care? And here's the three things that everybody wants to know. Survey shows, by and large, that the number one thing of concern is, who do I actually have access to? I'm in trouble. I need help. Where can I go? Who can I see? Who do I have access to? The second biggest thing is, how convenient is it going to be? Is this something that's readily available, or do I have to go way out of my way to have the access that I need to the healthcare providers I'm looking for? And thirdly, of course, is, how much is this going to cost me? Does this fit in my budget? Is this even in my world of possibilities? Or like other tens of millions of Americans, I just have to opt out because it just doesn't fit the budget? Those are the big questions. And here in the next few minutes, we're going to answer all of these and more for you. Let's go ahead. Yep. And so here's the big challenge. The challenge that people face now is that premiums, your monthly rates, what it costs you to have healthcare, it's just completely unaffordable for so many people. And you all know the deal. Deductibles, outrageous. They're skyrocketing. They're completely out of control, way too high. Same thing with the general healthcare costs. And we're so confused, it's hard to really know what to do. We hear someone say, well, I have this, and that doesn't sound so great. And someone says, well, I have that, and that doesn't sound too great either. So it's like, ugh, what do I do? What are really my options? And as I already mentioned, it's not just an approximation. Literally, tens of millions of Americans have thrown their hands up with disgust and confusion and say, forget it. I'm just going to take my chances and hopefully nothing happens to me, which, by the way, is not the best of plans, because it just so happens that one of the fastest ways to put all of your hard-earned efforts with your career and your investments that you built up over time, the fastest way to put those into jeopardy and at high risk is to end up with all too expensive medical care costs. Next slide. So here at 7K, we've got a brilliant plan. We have a way much better plan. And so we want to dive into some facts. First of all, where is this coming from? How are we structured? How is this set up? What's really going on here? And so the 7K healthcare program is a full liability, partially self-funded co-insurance health benefits program. Sounds like a lot, like a tongue twister. It's not that complicated. This is classified as an ERISA. There's basically two sandboxes to play in when it comes to healthcare. One is the traditional health insurance commissions, and the other one is an ERISA program. And ERISA is an acronym. It's on your screen. It stands for Employee Retirement Income Security Act. It was put into play by the federal government back in 1974. So this is the 46th year of its existence. Now, here's what's cool. With an ERISA, we have way more flexibility. It's like, first of all, it's kind of neat to think about playing in a sandbox. When you were a kid, you did that. You took empty glasses and compacted sand. You made sand castles. You put your army men out. You put out the little bulldozers and the fake brakes, and you made little gardens and all kinds of cool stuff. If you're going to play in a sandbox, you want to have toys. You want to have fun. You want to have freedom and flexibility. It's supposed to be enjoyable. That's what an ERISA gives us the ability to do. So that's a really good thing. And a lot of people want to know, okay, what about brass tacks though? Does this meet the Affordable Care Act? Does this meet tax codes and liabilities that a CPA is going to ask about? Good news, yes, capital yes, with an exclamation mark on the back of it. And other things that are relevant is, do we get nickeled and dimed? Okay, great, we get a healthcare plan. What about pharmacy, Scott? Or what about a dental plan? Or what about vision? I wear contacts. I've got to go see my optometrist. Great. All of that's included inside of the 7K Health freedom plans. And what about preventative care? Visits where you're not sick whatsoever. You just want to be sure. You want to go in for a routine physical. Maybe men, a colonoscopy, or ladies, a mammogram. Those things are covered when it's looked at from a preventative standpoint. No extra charges, no extra nickeling and diming. We love it. And then, of course, there's what about when I'm on vacation and going to Disneyland or headed to New York to go see the Statue of Liberty, or maybe to Northern California to see the beautiful coastlines? What if I'm out of my element and something happens and I just don't know what to do? Where do I turn? We've got an incredible built-in 24-hour medical assistance program. I actually, with no story, had to use it myself last November. It was incredible. I got nervous with a situation. I picked up the phone, called, talked to an MD, got some great advice, followed it. It worked out pretty well. Next slide. So 7khealth.com is the domain and the link you want to get really used to using. It's branded. You can click on this link. You can go to this link. Don't do it yet. Stay here with us and you can go play later. So stay in the moment. Here's the alternative. So rather than all the other things that we just discussed, we started laying the foundation for what's really behind 7khealth.com. Well, first of all, and traditionally and typically, our rates are much lower than traditional rates and premiums that people are used to having in the traditional insurance world. So much lower rates. Another thing that I really like is that we don't have any deductibles. So think about that for a second. As Jason mentioned, it's not uncommon for people to have deductibles anywhere from $3,000. I've heard as much as $15,000 personally with what people are paying for deductibles. So it's kind of a game, right? And I liken it to Las Vegas with the fact that there's two silo containers. One big silo is what your or your healthcare plan. And the other container is your deductible. So people say, well, you know what? I just don't have a lot of extra disposable income. And so I don't want to pay that much in my monthly rates. And so they go, okay, boop, they lower your rate. And what do they have to do to offset that? Increase your deductible. You're like, wait a second. I think that I'm much more likely to have to go in and have something done, a test, a procedure. I'm a high risk person. I don't want to have a ridiculous deductible. And they go, okay, no problem. Boop, they lower your deductible. What do they have to do? Offset it with a really high rate or a premium. So that's the game that's played. House always wins. And let's face it, what's really behind a deductible? The deductible is really an algorithm in the medical community, the benefits community, that says, what's the risk factor on this person or this group? What's the likelihood that you as a person or you as a family are going to have to make a claim? And based on that response is where your rates are traditionally set. So no deductible. I love the fact that there's no deductible. And I could tell you multiple stories in and of my own family where that came into play very, very recently. How about this one? Well, what about the fact that I've had to deal with this, or I've had that issue in my past and it's in my chart? Am I going to be disqualified? No, we don't have any pre-existing conditions or that would exclude you from being covered by a. I love that portion. How about no open enrollment? That's kind of a big deal too, because let's face it, in the traditional insurance world, you've got to jump through this little tiny window, like head first, and it's all fear-based. If you don't jump head first through that window, say like in Colorado between November 1st and December 31st, the consequence is so great. You're like, oh my word, I've got to make a decision, because if I don't in that window, you've got to wait a whole nother year, and then you're doing either this or you're doing this. Either way, it's a risk. So no open enrollment constraints. And then I love the fact that we deal with the largest PPO network provider in the nation. Listen, Jason always teased me because I had, one of the other companies for a cell phone carrier. And we'd be talking on the phone and I'd drop calls like, hey, buddy, when are you going to get with the program? Haven't you heard that Verizon has more towers than everybody else? I mean, if you're really serious about your phone calls, you'll switch. I'm so glad I did, actually. And this is not a plug for Verizon because I don't make a dime off of this endorsement. It's just an analogy. My point is this. If you want to have the best, highest likelihood, the best shot possible that your favorite people, your family doctor, all the hospitals that are in your area are going to be part of your network, you want to have PHCS for a network. What does that stand for? Another wonderful acronym, Private Healthcare Systems. Private Healthcare Systems, that's the network. Largest in the nation. So like that other company I just mentioned, we've got people. We've got the right network. We've got the right people. All of the staff that are behind this, that are backing this up, they're licensed, qualified, certified, test taken, with experience on the legal side and hospital billing codes. That's what's really behind all this. It's beautiful. That's what you get with 7khealth.com. And certainly not to be last or least, but think about the ease, if you will, of not having to go through medical underwriting, etc., with the freedom plans or the catastrophic program, which is absolutely brilliant. That means there's something here for all of us, and you don't have to wait, and you're not stuck in a nasty corner or a box to play just because you have some history. So those are some of the highlights with our alternative. Next slide.
Awesome. Now, Scott, they don't actually need to go to 7khealth.com. They can actually go to their 7K websites. They can go up to that right-hand corner. As long as they're logged in, they go to links and they go to check it out, and they go right to the 7K health plan, but it's tracking as them. So it already has them. You know, we've already done the APIs with the SBA freedom plans. So everything is connected through your back office. That's awesome, right? Because everybody on your teams, every time they go to enroll, you just tell them, go to your back office, go to your link section in your back office, click on this section, and it automatically tracks it for you. So anybody who enrolls on your team, you're going to want to know that, because we're going to talk about this at the end. You do get credit for anybody who is on these healthcare plans. So
I love that, Jason. So, you know, what you're saying is you've taken the high tech portion of this. You've embedded things. You've made everything convenient with only one site that they really need to know, and that's the back office of their 7K Health business.
That's right.
Beautiful.
So makes it beautiful. And the thing I like, what you just said, you guys have one of the largest networks in the country. Once they log in, they can scroll down to the bottom of the page, and one of the very first things that they see down there is find a provider. They can actually look in their area. They can actually type in their doctor and their hospitals that they're going to. They can check this all out right now. They don't have to.
That's right.
Am I covered? Right. This is a pretty intuitive website, and it's nationwide across the country. And with one of the largest PPOs, we went and looked at this just in Idaho Falls here, and it was amazing. It's every single state in the United States. Is that correct, Scott?
Correct. We're in all 50 states as well as U.S. territories. Wow. Which is brilliant. And Jason, while you're at this and you're showing this screenshot here under Find a Provider, this is such a wonderful game, because when you're talking to people, they're like, well, I wonder if my doctor's in there, or I wonder if my local hospital is in there. And what I want to make sure people understand, there's a reason why the instructions are in here. If you were to, for example, Google PHCS and just go straight in there, you don't see the level, the options that have been negotiated and made available to everybody for 7K Health. If you follow these instructions, which is the only great option, you will see a whole world of options and possibilities unfold before you by following those instructions.
Yep. And so I've done it myself, and it's awesome. I love that you can find pharmacies, you can compare plans. And one thing I wanted to point out, Scott, and I just want to make this really clear to everybody on this call. If you have healthcare insurance right now, there's probably a plan in here for you to help you offset maybe being underinsured or having high deductibles. Is that true?
Yeah, say that one more time. Is what true? Ask that one more time.
So if somebody already has health insurance, but maybe they're missing a little bit of coverage, maybe they have very high deductibles, so they're not even covered until they spend $3,000, let's say. There's a plan in here for them to help offset some of that risk. Is that true?
That is true. That is absolutely true.
And if there's somebody in here who has no health insurance and they want to come in and they want huge coverage, they're concerned maybe even about something big happening. Maybe they've had some cancer in their family in the history, and they want to make sure that they're covered so they can get treatment. We've got plans in here that can protect all the way to those massive plans and cover people fully. Is that true?
That is absolutely true. No doubt about it. I'd say this with all the humility in the world. You know me very well, Jason, and humbly speaking, I could afford any plan out on the market that exists. And when I look at everything that's out there, and I've already shared with everybody how I feel about the health benefits industry as a whole, of all the options that exist, I can tell you without thinking twice, this is the best plan for me and my whole family, and this is the only plan that we have.
Yeah. So that's the fun part. They get to go in here and compare plans. They have, plan A is for somebody who might want to supplement their health insurance. Plan B and then the catastrophic plans combined, that's when you're starting to get into big coverage, right? I know for myself, we had a daughter in soccer that was, everybody's healthy in the family, but she got undercut in a JV game. She was playing varsity. They put her on JV for one game, and a girl slid in and undercut her. And we had medical bills, and they were not fun to pay. But these SBA Freedom plans, they picked it up right from the get-go, covered our physical. Right from the get-go, it was covering it at 50%, you guys. That's what I like.
That makes sense.
And that's what I mean. It covers it from $1 when you start spending money, as long as it's qualifying. And that's the exciting part of what these healthcare plans can do.
Absolutely.
So Scott, let's talk about a little bit more. They've also got information in here. They've got brochures, 7K health plan brochures. They've got an Ask Catastrophic plan, and we're going to talk about that in a second. That gives huge coverage. I think up to $500,000 per individual in their family. So if they've got a family of four, that's what, $2 million of coverage.
Right. That's right.
So they've got brochures back there in this thing that are all built in. They can print these off. They can do comparisons. They can see all the benefits and information right there. They also have a complete training portal, which I love because it talks right to us. There's a lot of videos back there, interactive videos. What is ERISA? 7K health plans, 7K health plans provisions, base plans, preventative care coverage services. So you can be educated right here. Watch them as many times as you need to answer any questions that you might have on any of these pieces. So very intuitive training. And I think it's something that can be a very beneficial piece to helping them learn more about the 7K health.
I love this section here, by the way. Just the fact that you've gone to all this extent to put all these components in there. So for the person that really likes details, this is a great place to go to really dive in deep.
Absolutely. All right. Let's give them a little bit more stuff here. There's some awesome information here on the solution.
Absolutely. So, I love getting down to the solution. And so I just want to encourage all of you, just like the metals. And by the way, I love the metals. I'm a huge fan. I'm a huge advocate. And as important as that is, healthcare is one of those important topics. And now Jason and the team have made it available that this is one of your auto savers orders in your 7K business. And so it is one of those things that recurs every single month. They say, there's a survey done, Jason, where, your house is number one, your cars are number two, your cell phone's number three. Healthcare is right in there as one of those top priorities that people just will not do without. So once you have them, have people using this, they're not going to stop using it. So it's something that everybody wants to promote to your team. We don't want to make any assumptions, say, oh, it's in the back office, everybody should know about it. We want to be bold, we want to be brave, we want to be vocal, and make sure that from this call, everyone's aware of this conference call. It is recorded. You all have access to this. Anybody that misses it can go back and listen to this. But make sure when you're doing your conference calls that you're absolutely, reminding people as if they don't know, and actually encourage them. Did you take action? Did you make a decision? Did you pick a plan? Or which one did you get? Here's the one that I got. And start talking about it like it's just normal routine and it's what people are going to do. So you've got all this news in your back office, and really the simplicity is you're going to choose either an individual plan. An individual is simple. That just means you, and single, or you don't have any dependents living with you anymore. You're an empty nester and you're single. That's what we mean by an individual plan. It's just going to cover you. And then of course you've got the family plans. And so that's, 2 or more. So as you look at those options, there's 3 categories of plans. 1 is individual, and 2 define family, be you and a spouse, and then you and dependents. So pick the right plan for you. It's laid out very, very simply. You'll get it when you look at it. And then you want to add a catastrophic plan. You don't have to. It's just highly recommended. So people ask me all the time, Scott, what do you recommend? And my answer is always the same. I recommend that you afford whatever you can and put that into place. So let me just state this. Our freedom plans are very robust, and you'll see that. They cover a lot. The average claim, there's a new statistic that came out, and I just read this. About 95% of our population under the age of 65, because that's when Medicare starts. So we're not talking about 65 and older. Up to the age of 65, 95% of that group is making annual claims of $7,000 to $8,000 a year. That's it. So it's interesting that we're all paying monthly traditionally as if hundreds of thousands of dollars of bills are just going to get heaped at you at any given moment. The reality is most people don't deal in that world. And that's why we, with 7K, have separated those out. So you've got a really robust plan. They call those the freedom plans. Then you've got the ASH catastrophic plan, which is parlayed on top if you want to, above and beyond the freedom plans, which, oh, by the way, are covered at 100%. So if you have a catastrophic plan laid on top of a freedom plan, and you are so unfortunate to have to use it, or fortunate that you have it when you need it, whichever way you want to look at it, those plans are covered at 100% with no more money out of your pocket, which I really love. And there's 3 layers there. There's a plan for $150,000, there's a plan for $250,000, and a plan for $500,000. Here's one simple thing you want to know. Our rates are so good, they've all been negotiated, that you can approximate that there's a 2x factor. In other words, our rates are about half of what hospital billing codes are, roughly, give or take. It's not exact, they're just around about that. So when we say a $500,000 plan for the catastrophic program, it's really got a value on the retail hospital billing code market of upwards of $1 million. And as Jason said, that's per person in your family per year. That's a big deal, my friends. And there's a phone number there. If you have any questions and you want to talk to experts or people that really understand this topic, 208-273-5001.